Good afternoon, students. I hope you all are safe. Today I will start the remaining part of chapter number 4, Disease Manifestation and Pathophysiology. In previous lecture we have discussed about the tuberculosis, hepatitis, rheumatoid arthritis, diabetes, peptic ulcer and cardiac vascular disease. In cardiac vascular disease, congenital heart disease we have seen in previous lecture. Now see the acquired heart disease. Acquired heart disease are caused by the variety of factors like diabetes, obesity, lack of exercise and smoking, etc. In acquired heart disease, rheumatic heart disease, then hypertension. First is rheumatic heart disease. This disease caused by rheumatic heart fever, which is caused by the beta hemolytic streptococci. Firstly, it is affect the throat, then spread in the joints and finally affect the heart. In rheumatoid heart disease, firstly affect on the throat and then spread over the in the joints and finally affect on the heart. Then hypertension. Hypertension is the one of the commonest heart disorder in cardiovascular system. Blood pressure is measured at systolic and diastolic. Systolic and diastolic means systole is the when blood is pumped out of the heart and diastole is when the heart is at rest and blood returns to the heart is diastole. Then uh, blood flow, that is 120 to 80 mmHg in range. A person who reading are consistent above 140 or 90 mmHg may be said to have hypertension. The diastolic blood pressure means hypertension is a classic silent killer. Okay, next is etiology and pathophysiology of acquired heart disease. First is primary hypertension and second is the secondary hypertension. In primary hypertension, it is also called as the essential hypertension. Primary hypertension is also called essential hypertension. More than the 90% of patients with elevation of arterial blood pressure with unknown or identifiable cause. In general, increases in the blood pressure is regulated by barometric feedbacks mechanism with renin-angiotensin and aldosterone, kallikrein, and then canine and sympathetic system. Essential hypertension may disturb barostatic messages, causing the arterioles to respond improperly. Okay. Then in secondary hypertension, in this type, the cause of hypertension is known. The cause are under. First is acute chronic renal disease. Then next is renal artery stenosis. Then third, hyperaldosteronism or endocrine disorder. Then next is drug induced hypertension. Then next, oral contraceptives, may also estrogen and progestin, example. Then HMO inhibitors and cyclosporine. These are the cause of secondary hypertension. First is acute renal disease, then renal artery stenosis, then hyperaldosteronism, drug-induced hypertension, oral contraceptive, cyclosporine. That is the causes of secondary hypertension. Then sign and symptoms of acquired heart disease. First is head with tinnitus and a ranging sound in the ear. Then second is bleeding may occurs from the nose. Then third is dizziness and vertigo. Fourth is oedema of optic disc. Also papilledema, and due to the increases in intracranial pressure followed by blindness. And last one is brain hemorrhage. These are the signs symptoms of the acquired heart disease. Head with tinnitus, then bleeding may occur from the nose, dizziness, then oedema of optic disc due to the increases the intracranial pressure followed by blindness, and last is brain hemorrhage. These are the acquired heart disease. Then next is ischemic heart disease. Ischemic heart disease is also called as the coronary heart disease or CHD, in which there is the imbalance between the myocardial demands and blood supply. Okay. Then the most common cause of ischemic heart disease is the reduction in coronary artery blood supply due to arteriosclerosis, virus form of CHD are also. CHD means coronary heart disease are as under. First is various sorry First is angina pectoris, second is myocardial ischemia or infraction, then congestive cardiac failure, then cardiac failure, and various factors responsible for the coronary heart disease are fat or rich diet, then hypertension, diabetes, excessive smoking and alcohol drink, then secondary life with lack of exercise, and last is obesity. These are the various factors responsible for the coronary heart disease. First, fat for rich diet, hypertension, diabetes, excessive smoking and alcohol drink, secondary life with lack of exercise and obesity. Okay. These are the ischemic heart disease. Then next is angina pectoris. The myocardial ischemia characterized by the pericardial discomfort. Then etiology and pathophysiology of the angina pectoris is the cause of angina pectoris mainly due to the obstruction occurs in coronary artery, includes atherosclerosis, spasm, then and coronary embolism. Then apart from these, aortic stenosis and also castid. Then angina result from the lack of oxygen supply to the myocardium and increased demand condition due to the inability of coronary artery. The myocardium demands condition due to the inability of coronary artery. Then myocardial becomes ischemic with localized necrosis. Then pH of the coronary sinus blood falls. Loss of cellulose potassium may occur. Then deterioration of mainly left ventricle. Deterioration of mainly left ventricle may observed on the ECG, electrocardiogram graph. Then sign and symptom of next is sign and symptoms of angina pectoris. First is discomfort in the thorax region, radiating to trunk and shoulder, and shoulder is the left shoulder and lower jaw. Then second is myocardial infarction in the left with burning sensation. Then squeezing and choking sensation. Then discomfort may form 30 seconds to 30 minutes in case of anginal attack, but in myocardial it may persist for few hours. And last is nausea, vomiting and headache are very common. In angina pectoris, sign and symptoms is very common. Is what? The nausea, vomiting and headache. These symptoms are the very common. These are the angina pectoris. Sign and symptoms is discomfort in thorax region, then radiating to the trunks and shoulder, left shoulder and lower jaw. Then sneezing and choking sensation. Nausea, vomiting, headache is very common. But discomfort may for 30 seconds to 30 minutes in case of the anginal attack, but in the myocardial it may persist for few hours. Okay. Next is vascular disorder. Vascular disorder is also called as atherosclerosis. Vascular disorder is also called as atherosclerosis. Basically, it is a vascular disorder belonging to the atherosclerosis. Then atherosclerosis characterized by the patchy subintimal thickening of coronary artery resulting into the reduced or obstruct blood flow to the heat. What? Basically, it is the vascular disorder belonging to the atherosclerosis. Atherosclerosis characterized by the patchy subintimal thickening of coronary artery resulting into the reduce or obstruct blood flow to the heart. Then pathophysiology of the vascular disorder. Atherosclerosis plague consists of the accumulated intracellular and extracellular lipid, smooth muscle cells, then connective tissue. It is initiated with deposition of fatty strip, with later converted to the fibrous plaque cause reduced elasticity. Okay, elasticity that resulting into the reduced systolic expansion and abnormality wave propagation. Okay, the development of the atherosclerosis comprises is the lipid deposition and by chronic endothelial injury. Then the lipid deposition hypothesis postulate that LDL penetrates into a arterial wall leading to lipid deposition in a smooth muscle cell, and it is macrophages. This deposition LDL then modified or oxidized, which first chemostatic to monocytes, promoting their migration into intima and their early appearance in fatty stick. Then next is then the chronic endothelial injury occurs by virus which produce loss of first is endothelium, then second is aggregation of platelets, and third is adhesion of platelets. Then next is collectively this form of fibrous plaque. Sign and symptoms of vascular disorders or atherosclerosis. As such, atherosclerosis is characterized as such atherosclerosis is characteristically silent until other cardiovascular disorders such as thrombosis, aneurysm, or embolism supervenes. Symptoms develop gradually as the atheroma. Dramatic signs are observed when the major artery occluded that causes the reduction in blood flow to that affected area of the heart, resulting angina, then claudication, myocardial and infarction, ischemia, etc. These are the signs and symptoms of vascular disorder. Then treatment of vascular disorder. Atherosclerosis treatment is usually followed at the complications such as first is angina pectoris. Drug are the amlodipine 5 mg once daily, then benedipine 4 mg NID, then diltiazem HCl is 60 mg TID. Then arrhythmia drugs are isoprenaline, diltiazem HCl and adenosine. Then third is myocardial infarction and drugs are captopril, initially 6.25 mg per day, and ramipril initially 2.5 mg BID. These are the treatment of the cardiovascular atherosclerosis. What is treatment? The atherosclerosis first is angina pectoris, second is arrhythmia, and third is myocardial infarction. In angina pectoris, drugs are amlodipine 5 mg once daily, then benedipine is the 4 mg NID, and diltiazem HCl is 60 mg TID. Then arrhythmia, isoprenaline, then diltiazem HCl and adenosine. Then myocardial infarction, captopril initially 6.25 mg per day and ramipril initially 2.5 mg PID. These all about the vascular disorder or atherosclerosis. Here are the complete the cardiovascular disease. Next is epilepsy. Epilepsy is a chronic functional disorder of the nervous system and usually associated with loss of consciousness by recurrent generalized transient seizure having onset and spontaneous resolution. In epilepsy, epidemiology means the occurrence of disorders is highest in the first 10 years of life and minimized thereafter till age of 50. The reasons for that with epilepsy includes accident, then tumors. Cerebral vascular may occur due to two primary or acquired abnormalities of central nervous system, then metabolic disturbance of and numbers of the systemic disorders. Then next is seizures result due to an imbalance of excitatory and inhibitory influences within the brains. GABA, that is amino botanic acid. Then sodium channels and potassium channels plays a role in depolarization, which followed by hyperpolarization, which result into the efflux of intracellular ion. For example, calcium. These bursts of action potentially are the originating effect of a seizures. Then these three are the epilepsy. First is grand mal epilepsy and second is the partial seizures. In a grand mal epilepsy, in this type there is a sudden loss of consciousness and falling injury tonic the cerebral cortex resulting into following form. In grand mal epilepsy, these two epilepsy, grand epilepsy and petit mal epilepsy. In grand epilepsy, there is sudden loss of consciousness, then falling of individual tonic-clonic jokers of muscles in unconscious state of the last about 30 minutes after awaking. The patient cannot recollect the event of the proceeding. Then petit mal epilepsy is the in that petit mal epilepsy the consciousness state remains for the second only. Jerk of arm with blinking eye and leads may observe. Then the patient cannot show facial movement. In petit epilepsy, consciousness state remains for the secondary only. Jerk of the arm and with blinking eye and lead may observe. The patient cannot show the facial movement in petit mal epilepsy. Okay. Then next is partial seizure. This involves the facial brain lesions. There are two categories among the seizures. First is simple partial seizure and second is complex partial seizure. In simple partial seizure, in this there is no loss of consciousness and the manifestation depends on the site brain region. It B. Motor part involves the contraction of body part and sensory part causes number to one part of the body. Then in complex partial seizure, also called as the psychomotor seizure, the lesion occurs in the temporal regions of brain. Then sudden environment or emotion change like smell, then feeling followed by the loss of surrounding. It lasts for few minutes. Then these are the part of epilepsy. Then next is treatment of epilepsy is long-term therapy is for at least 3 years, sometimes lifetime. Then first treatment initiated with carbamazepine is 100 to 200 mg BID. Then clonazepam is initially 1 mg at night and phosphenitoin is a 15 mg per kg by intravenous IV. Phosphophenolatoin is a 15 mg per kg by IV intravenous route. Then next second is occasionally used drugs. That drugs is phenobarbital and carbamazepine. These are the treatment of the epilepsy. First is treatment is initiated with carbamazepine, clonazepam and phosphenitoin. Then occasionally used drugs, phenobarbital and carbamazepine. Okay, here are complete the chapter number 4, disease manifestation and pathophysiology. Disease manifestation and pathophysiology of tuberculosis, hepatitis, then rheumatoid arthritis, diabetes, peptic ulcer, cardiovascular disease, and epilepsy. Okay, here are complete this chapter. On this chapter, ask the question like, write a detail about the pathophysiology, symptoms and treatment of the tuberculosis. Then second question, write a detail about the pathophysiology, symptoms and treatment of hepatitis. Then write in detail about pathophysiology, symptoms and treatment of diabetes. Then cardiovascular disease and epilepsy. And after watching this video, you are able to answer these all questions. Okay, thank you. I will stop here.